are at the point in which we are thinking if there are more causes of stroke than ones that have been traditionally stated. We mainly know that atrial fibrillation, large artery disease, small vessel disease, dissections, known mechanisms are associated to ischemic stroke. But we also start to think about new mechanisms. And one of the mechanisms that has been mentioned is the presence of silent myocardial infarction. There were some epidemiological studies and population-level studies that showed that patients that had silent myocardial infarctions actually had a higher risk of having stroke. So what we did was to go and study these patients by doing CMR. So we used a cohort of patients that were classified as having undetermined stroke etiology, and they did not have a known history of myocardial infarction, and we did CMR to know if they had silent myocardial infarction. And our idea is to see if these patients with undetermined stroke etiology would have a higher prevalence of these events than patients that did not have a stroke. But actually what we found was that the prevalence of silent myocardial infarction was not higher in our cohort. So probably, at least in the Portuguese population, it doesn't seem to be a very relevant mechanism.